cardiac arrest can happen at any age.
And a York County family knows that all too well. Josh and Leah Miller shared their daughter Bristol's story. 6-year-old Bristol Miller is one happy little girl. It's hard to believe what she went through when she was 14 months old.
It was March 1st when the event happened.
Bristol was at the babysitter's.
She was fine all morning, and that afternoon she went down for a nap, and the babysitter heard her cry, so she went in to pick her up out of the crib and laid her down on the floor to go get a bottle, and came back and she found her. She was unresponsive on the floor.
The babysitter took 2 important steps. She gave Bristol CPR and called 911, a call that her dad found out about immediately. He's a paramedic.
They came in as a 14-month-old cardiac arrest at that address. I knew the address, and she was the only kid back there that day that was that age, so I knew it had to be her.
My father-in-law, my brother-in-law, and my husband were some of the first responders on the scene.
We started, we were doing CPR, and when we got her on our cardiac monitor, she had a shockable rhythm, so we defibrillated her.
Initially, Bristol went to a local hospital, the same hospital where her mother, Leah, works. She's a nurse practitioner in cardiology.
You understand everything as a medical provider, and as you got to kind of try to look at it that way, but then also as a parent, it definitely makes you look at it a little bit different.
After Bristol was stable, she was airlifted to Penn State Health Children's Hospital.
In the beginning there's a lot of unknowns, which is why it happened, what caused it, could it happen again.
Over the next couple of days, she had, testing of her heart. She had an EEG to look at her brain activity to see about seizures. And all of that really was unremarkable. They couldn't really find a cause. They couldn't find a reason as to why this happened. And so then ultimately they decided to put a defibrillator in.
She came out of surgery, woke up, was doing good. They were talking about discharging us to go home. And then she had a seizure. We went back to the drawing board.
There were a few complications that ended up pushing Bristol's stay in the hospital to 5 weeks.
Neither Josh nor I left the hospital room at all overnight or for an extended period of time in those 5 weeks.
Bristol's next step was Penn State Health rehabilitation, and then she was ready to go home.
It was mid-April. She came home, and we were greeted at home by a bunch of friends and family, and then we kind of got to ease our way back into daily life.
And that was 5 years ago. Look at Bristol now.
She likes anything Barbies, anything pink, unicorns, sparkly, whatever. And so really it is just to kind of keep things as normal for her as possible.
She's a normal 6-year-old now, and she runs with the best of them. She plays at school, gym. She's a good kid.
Well, joining me now is Dr. Jason Imundo, Director of Cardiac Electrophysiology at Penn State Health Children's Hospital. Bristol's story is amazing. How did you get involved in the case?
Thanks for having me, Amy. It is an amazing story. So I'm a cardiologist, but I'm in charge of heart rhythm abnormalities. So anytime there's a patient who comes into our children's hospital with a suspected heart rhythm abnormality, the team will contact me for advice, and that's how I got involved in Bristol's case.
How is Bristol doing today? I mean, her parents said, hey, she's happy, she's a good kid, but is she recovered?
Oh, she's doing wonderful. She's an active 6-year-old. She's intelligent. She has got an amazing personality. She's been through so much, and to talk to her, to see her, you would have no idea that anything has ever happened to her heart.
Goodness. Having a heart attack, a young child, you really don't think about that happening, even as new parents. Like, that's not what you're worried about, right? So how common is this? Are there symptoms that parents can look for?
You know, it's every parent's worst nightmare. Fortunately, this is very rare. Does not happen often. It's different than what happens to an older person when they have a heart attack. For a young person, it's usually there's a heart rhythm abnormality. Things that people could watch out for would be if a child was to pass out, especially during activity, if they were to complain of heart racing, or even shortness of breath. Those are things that should be brought up to their primary care doctor, pediatrician, and then if they had concerns, they would refer the family to a pediatric cardiologist.
So Bristol actually suffered cardiac arrest. What are some other conditions that you see children for?
Yeah, so at Penn State Health, we are very lucky. We have a world-renowned group of invasive and non-invasive pediatric cardiologists and congenital heart surgeons. We take care of all types of cardiac disorders, before birth, during fetal development, all congenital heart disease after birth, and then preventative cardiology. And for me, I do a lot of heart rhythm work.
We know as adults that it's important to take care of our hearts, and we know to keep our children healthy, do their regular appointments. What can we start doing when they're quite young to encourage heart health and to keep them heart healthy?
Yeah, it's a great question. I think as adults, we know that we try to stay away from things like saturated fats, sugars. We try to do daily physical activity, but the thing we could do to teach our kids would be to lead by example, show them that everything we're telling them that we're practicing.
That's good. So you should eat the fruits, you should eat the vegetables. If your children see you doing it, that's what will be natural for
Absolutely.
them, right? Very good. Thank you so much, Dr. Imundo. Good to have you with us today.
You.
For more information or to make an appointment with the Children's Heart Group at Penn State Health Children's Hospital, call 866-244-2273 or visit pennstatehealth.org/children.